Okay, great. Thank you very much. So it's just 4 minutes past 12 o'clock and we've got 62 attendees, which is great. So I think we will kick off now. So thank you everybody for joining us at this in the first of our 2023 Lunch and Learn series. We did a couple of these last year and I think they were very successful. So thank you for joining into this one. I'm Dr Lucy Jessop. I'm a consultant in public health medicine and I'm the National Immunisation Lead at the National Immunisation Office. Next slide, please, Yvonne. So just to let you know, this session is being recorded, so you can get it later on YouTube and Spotify. You'll get an attendance certificate if you attend for the entire session and you're registered. And please do make sure for everybody's enjoyment of the seminar that your camera is off and you remain on mute. And if you want to ask questions, hopefully we will have some time at the end, so do type those into the chat box and then we can try and answer those questions. Next slide, please. So first of all, I'm just going to spend a couple of minutes with a brief introduction and then we're very grateful to have Dr Margaret Brennan with us. She's a specialist registrar in public health medicine and she did a review on the effectiveness and efficacy of the and immunogenicity of a single dose HPV vaccine and she's going to share the results of that. The studies with us, and then Yvonne Morrissey, who is our business project manager in the NIO, is going to share some key messages about becoming an HPV vaccine champion at the end. So next slide, please, Yvonne. You may be aware, you may have seen this on some social media channels, for example, that it's Cervical Cancer Prevention Week this week. And this week, during Cervical Cancer Prevention Week, we are launching Ireland's roadmap to cervical cancer elimination. And for those of you who can see the slides, there's been a journey in terms of cervical cancer prevention in Ireland. So that started in 2008 with the launch of Cervical Check. So making cervical screening available to all women of a particular age. And then in 2010, the National Immunisation Office launched the Schools HPV Vaccine Programme for girls. So that was launched in girls who were in first year of second level. And then there was also a catch-up programme available for those at the time up until sixth year in second level school. Then in 2019, we expanded the Schools HPV programme to boys as well. So from 2019, it's been available to boys and girls in first year of second level school. 2020, Cervical Check moved to an HPV cervical cancer screening programme. And the WHO in that year also published the global strategy to accelerate the elimination of cervical cancer as a public health programme. Then last year in Ireland, we started to work with Australian experts to model the date for when Ireland could target the elimination of cervical cancer, and we've been working with them since then. And then at the end of last year, we launched the Laura Brennan catch-up programme for HPV vaccine. And during Cervical Cancer Prevention Week, so this week, we are launching this roadmap to show what is happening this year. And we hope in November 2023, we'll be able to set that target date for elimination of cervical cancer as a public health problem. And now it's important to note that that doesn't mean there will be no cervical cancer. It means there will be less than 4 per 100,000 cases of cervical cancer. So it becomes a rare disease rather than there will be no cases of cervical cancer. So there are 3 different targets to get to that elimination goal. So there's 90% of girls fully vaccinated with HPV vaccine by the age of 15. Which is what we're really going to be concentrating on today. But then there are also 2 other targets. So we need 70% of women to be screened at 35 and then again at 45. Obviously in Ireland we would do that more frequently, but these are the targets the WHO have set. And then also 90% of women identified with cervical disease receiving treatment. So that's 90% of those with precancers and with invasive cancers are managed. So working together with our partners in screening and cancer, and obviously with ourselves with the HPV vaccine, we hope to be able to set a date for cervical cancer elimination, which would be really amazing for us to be able to say that we could make this disease a rare disease. As we know, it's a disease that particularly affects young women and can have very devastating consequences for them and their families. If you move to the next slide, please. So what we want people to know in Cervical Cancer Prevention Week, and you will see that in some of the things you might have seen already on social media or you might see throughout the week, is that we want people to be aware about cervical cancer. We want them to know that it's preventable and treatable, but really you have to have it detected early and managed well. We want people to understand what cervical cancer is and how to reduce their risks, how it's linked to the HPV virus, that vaccination can prevent and protect against HPV and therefore protect against cervical cancer developing. We want to make people aware again about the role of cervical screening, making sure that we can reduce the incidence and the impact of cervical cancer, and making sure women do come forward when they're eligible and at regular intervals. And the symptoms of, we need people to understand the symptoms of cervical cancer and where to go if you're experiencing them. So those are the real messages for Cervical Cancer Prevention Week, and that will be promoted this week. If you move on to the next slide. So one of the things I mentioned is, as part of this, trying to make sure that everybody, girls up to the age of 15, have HPV vaccine, and then obviously making sure that we have good coverage in our young women, is the Laura Brennan HPV vaccine catch-up programme. So the Minister for Health, along with Laura Brennan's family, announced this in early December of last year. And it's been named after Laura Brennan, as most people will be aware. She was a very keen advocate for cervical cancer prevention and for the HPV vaccine particularly, and she very sadly did pass away herself from cervical cancer when she was very young, at the age of only 26. So although we have very good coverage of HPV vaccine in Ireland, so we know over 500,000 people have already been vaccinated with the HPV vaccine, we know there are some people that still haven't been protected. And so the idea of this catch-up programme is that it will be ongoing until the end of 2023. And we're offering everybody who's eligible to have another opportunity to join the HPV vaccine programme. So the vaccine will be available in this programme to girls who are in 2nd to 6th year of secondary school, and also women who've left school who are under the age of 25. And then it will be available also to boys who were previously eligible. As I said, we started the programme in 1st year boys who were in 1st year in 2019. So those boys will now be in 2nd to 4th year of secondary school, or for some of those boys that may have skipped TY year, they will be in 5th year. So it's only available to those boys who would have been eligible into that. But we're hoping as we go throughout the year, we will have a good uptake of that vaccine programme. If you go to the next slide, please, Yvonne. So we're delivering the programme in phases. We launched the first phase in December, like I said, and that's vaccinating those 16 years and older who are eligible. And that programme is being delivered by the HSE school teams, along with some support with the CVC teams and using the CVC sites. So if there are any eligible people who are age 16 and over, they can book an appointment online now for that programme, and there are appointments available all across the country. So anyone who's interested in that needs to visit hpv.ie for information, and that vaccine will be provided free. So what people may not remember, particularly maybe women who are 23, 24, they might not remember whether they've been vaccinated. So actually, if you go online there and you try to book an appointment, the system can actually check in the background. And if we know that we see that you already have a vaccine record, then the system will tell you, and therefore you don't need to come forward for the programme and to book an appointment. And if we don't have a record of your having HPV vaccine previously, then it will allow you to book an appointment. So that's actually a very helpful thing for people to know. If they can't really remember if they've been vaccinated, the system is actually able to check for you to see whether you've been vaccinated, and it will remind people of the eligibility criteria as well. Now, the school vaccine programme in 1st year continues as normal, and that's not part of the catch-up programme. It's only a catch-up programme for those outside of 1st year, but the 1st year in general, their HPV vaccines would have already been given in the 1st term of this academic year anyway. If you move on again, Yvonne. So that is the end of my part of the presentation, so thank you very much for that. And we are now going to move on to Margaret Brennan. As I said, Margaret's a registrar in public health medicine, and she has done some work for the National Immunisation Advisory Committee, and she will present that work to us. And that work has been very important in looking at moving to a single dose of HPV vaccine. Thanks, Margaret.
Sorry, I can't turn myself off mute while I'm sharing, so just going to reshare again. Okay. Can you all see the slides and hear me okay?
Yes, thank you, Margaret.
Okay, great. Thanks, everyone. Okay, so afternoon all, thanks for the opportunity to present here today. As Lucy mentioned, my name is Dr. Margaret Brennan, and I'm a 2nd year public health specialist registrar working in Public Health Area B. My presentation today is based on a review of evidence that I worked on last year on the efficacy, effectiveness, and immunogenicity of a single dose of HPV vaccine in 9 to 14-year-olds. This review was utilised to inform national vaccine policy recommendations made by the National Immunisation Advisory Committee, or NIAC. My co-authors on this work were all members of NIAC and included Dr Laura Brennan, Consultant in Infectious Diseases at Vincent's, Dr Lucy Jessop, Director of the National Immunisation Office, Dr Kevin Kelleher, and Dr Mary Ward, Consultant in Public Health in Area B. So, the background to this work. Firstly, some HPV epidemiology. There are over 100 types of human papillomaviruses, and the main mode of HPV transmission is sexual contact. Anogenital HPV is the most common STI worldwide. Indeed, it is thought likely that most sexually active people have been infected or exposed to HPV at some point, and some may even have been repeatedly infected. Over 90% of those infected clear the infection themselves within 2 years, but persistent oncogenic HPV infection is causally associated with anogenital and oropharyngeal cancers, such as cervical cancer. Worldwide, 4.5% of all cancers are attributable to HPV, over 80% of which are cervical cancer. So the HPV vaccines. The first HPV vaccine was licensed in 2006, and there are now 3 available in the EU. These are pictured on the right. Cervarix, which is a bivalent vaccine, Gardasil, which is a quadrivalent vaccine, and Gardasil 9, which is a 9-valent vaccine. These protect against 2, 4, and 9 types of HPV respectively, and we use the 9-valent vaccine at the moment in Ireland. All 3 are prophylactic subunit vaccines. Internationally, HPV vaccination programs have shown substantial population impact, with large reductions in both the prevalence of HPV infection and HPV-related disease, such as anogenital warts and cervical disease. Largest effects have been seen with multi-age cohort vaccination and where high vaccine coverage has been achieved. Importantly, the HPV vaccine dose schedule has been reduced before. Originally, 3 doses of the HPV vaccine were given to those aged 9 to 14, as this is what was investigated in the original efficacy studies. But by 2014, there was data showing that the immune responses or antibody levels provoked 2 or 3 doses of the HPV vaccine were comparable. Due to these findings, the WHO recommended that 2 rather than 3 doses of the HPV vaccine could be used for those aged 9 to 14. So last year, the question was, is there now evidence that 1 dose of the HPV vaccine actually provides comparable protection to 2? And can we move to 1 dose now? So in Ireland, as Lucy mentioned, the HPV vaccine has been offered to girls aged 12 to 13 in the schools programme since 2010. And since 2019, this has been a gender-neutral programme, meaning 2 doses of the HPV vaccine are offered to all boys and girls aged 12 to 13. In the academic year 2020-2021, national uptake of at least 2 doses of the HPV vaccine in schools programme was 76.6%. Of note, lower uptake has been reported in disadvantaged schools previously. HPV vaccination is one of 3 pillars of the WHO's strategic plan for cervical cancer elimination. This aims for 90% of girls to be fully vaccinated against HPV by 15 years, 70% of women to be screened by 35 and again 45 years old, and 90% of women who are identified with cervical disease to receive treatment. Unfortunately, global introduction of the HPV vaccine has been profoundly unequal thus far. In this map, countries coloured in green are those who have introduced, and countries in grey are those who have not. Many who have not introduced the HPV vaccine as yet are lower income countries, who are also less likely to have screening or treatment for HPV-related disease easily available. This is resulting in profound global health inequalities in HPV-related disease. For instance, 90% of cervical cancer deaths worldwide occur in low and middle income countries at present. Barriers to HPV vaccine introduction have included cost, a global shortage of HPV vaccines, and potentially the logistical challenges in administering multi-dose schedules. Next, I want to talk a bit about international HPV vaccine program performance. So these are the countries that have included HPV vaccination in their national schedules. So the graphs on the slide come from a 2021 paper by Bruni et al. The graphs on the left are a list of high-income countries ordered by HPV vaccine coverage achieved in girls, high coverage at the top, down to low coverage at the bottom. And the graph on the right is a list of low and middle-income countries, again ordered by HPV vaccine coverage achieved. On both graphs, the yellow circles represent first dose coverage, and the blue circles represent final dose coverage. From these graphs, we can see three important things. Firstly, very few countries are achieving the 90% or exceeding the 90% target set by the WHO in their cervical cancer strategy. Secondly, there's considerable variation in the HPV vaccine coverage achieved between countries. And lastly, there's quite a gap between first and final dose coverage in many countries, meaning that there is drop-off in attendance for a variety of reasons. Due to unequal HPV vaccine introduction worldwide and underperforming vaccine programs, global HPV vaccine coverage is suboptimal. In 2019, it was estimated that only 15% of girls and 4% of boys globally were fully vaccinated against HPV. This is far short of the 90% target set by the WHO. And unfortunately, during COVID, healthcare pressures and school closures resulted in disruptions to regular immunization programs, which are thought to have further adversely impacted global HPV vaccine coverage. Due to these challenges, single-dose HPV vaccination has been of considerable international research interest, and a review of the evidence was requested by NIOC in December 2021. So we're now moving on from the backgrounds to the methods we used on our review. The research question for the review was, in 9 to 14-year-olds, what is the evidence for the efficacy, effectiveness, and immunogenicity of one dose of HPV vaccine relative to 2, 3, or no doses of the HPV vaccine? And as you can see, we used the PICO, or the Population Intervention Comparison and Outcomes Framework, to structure this research question. The literature search utilized databases, research registries, key reference lists, web search engines, and direct email correspondence with key authors in this field, such as Dr. Basu from the International Agency for Research on Cancer. After title and abstract screening, I proceeded to data extraction. I conducted critical appraisal using validated tools as recommended by the Cochrane Handbook, and certainty assessment using the GRADE approach. Lastly, I completed narrative synthesis of the evidence grouped by review outcome. Now our results. 35 unique studies were included in the evidence review. There were 3 systematic reviews. Whitworth's review reviewed efficacy studies and concluded that one dose may be as efficacious as 2 or 3, but called for more evidence, whereas Markowitz reviewed effectiveness studies, most of which reported highest effectiveness for 3 doses. Importantly, this review identified significant biases that negatively impacted 1 and 2 dose estimates in observational studies, such as systematic differences by doses received and lack of use of buffer periods after vaccination. Lastly, Seeker reported that antibody levels after 1 dose were lower than after 2 or 3, but flagged that as the level of antibodies that are needed to provide protection against HPV were unknown, the clinical implications of this finding are unclear. There were 4 studies published subsequent to the systematic reviews reporting single-dose HPV vaccine efficacy. I'd like to draw your attention in particular to the first paper by Barnabas at the top. This was a superiority randomized controlled trial conducted in Kenya, which demonstrated high single-dose vaccine efficacy for both the bivalent and non-valent vaccines at 18 months. Then, the other 3 studies by Basu, Kramer, and Sang from India and Costa Rica, respectively, all reported comparable efficacy for 1, 2, and 3 doses of HPV vaccination, and importantly, that this is sustained at 10 to 11 years follow-up. There were 20 studies reporting single-dose HPV vaccine effectiveness published after the systematic reviews. The results from these studies were more mixed, reflecting issues with residual confounding, variable usage of buffer periods, and limited precision or power. However, despite this, 9 effectiveness studies reported no statistical evidence of a difference between dose arms. There were 10 studies reporting on single-dose HPV vaccine immunogenicity. The key takeaways from these are illustrated on the graph, which shows HPV-16 antibody levels by doses received up to 11 years post-vaccination in Kramer's post-hoc analysis of data from the Costa Rica vaccine trial. On the graph, you can see the black line associated with natural immunity is at the bottom. The sky blue line represents the antibody levels associated with 1 dose, red 2 doses, and purple 3 doses. This graph shows that one dose of HPV vaccine is associated with lower antibody levels than 2 or 3, but higher than the levels seen with natural immunity, i.e. after HPV infection. And secondly, it shows that single-dose antibody levels are stable and durable up to 11 years. Importantly, as previously flagged in Seeker's systematic review, the level of antibodies actually needed for protection against HPV infection and subsequent disease is unknown, but the antibody levels provoked by a single dose have been shown to be associated with high vaccine efficacy that is comparable to that provided by 2 or 3 doses. As part of the review process, we discussed the evidence with Professor Andrew Pollard, an international expert in immunology, who advised that after such a long period of stability, it is not biologically plausible that the antibodies would suddenly decline, i.e. immune response is expected to be sustained beyond 11 years. Overall, there is substantial evidence that single-dose HPV vaccination is likely to provide high levels of protection that is comparable to that provided by 2 or 3 and durable for at least 11 years. This could have large implications for national and international public health. Nationally, resources currently used for second dose delivery could be redirected to initiatives to increase uptake, and particular focus should be given to disadvantaged settings where lower HPV vaccine uptake has been reported previously. This could reduce future inequalities in HPV-related disease. Internationally, single-dose vaccination could positively impact global HPV vaccine supplies and could be more feasible to implement and maintain in all income settings. This could accelerate progress towards the WHO target of 90% global coverage and ultimately contribute to cervical cancer elimination. As regards international vaccine policy last year, in April 2022, the Strategic Advisory Group of Experts, or SAGE, who advised the WHO on immunisation, issued a recommendation that countries may now choose between 1 or 2 doses of the HPV vaccine on the basis of providing comparable levels of individual protection while being more cost-effective and efficient, meaning fewer doses per cancer case prevented. And in August 2022, the Joint Committee on Vaccination and Immunisation, or JCVI, who are the Immunisation Advisory Committee for the UK, advised a move to the 1-dose schedule for the routine adolescent programme, as they considered the evidence very strong that 1 dose provides similar protection to that induced by 2 doses. Most recently, in December, the WHO have released an updated position paper on HPV vaccines, which is well worth a read if you're interested in this area. In this, single-dose HPV vaccination is recommended as an off-label use on the basis that current evidence suggests that a single dose has comparable efficacy and duration of protection as a 2-dose schedule, and may offer program advantages, be more efficient and affordable, and contribute to improved coverage. The recommendations arising from this review are as follows. 1 dose of HPV vaccine was advised for 9 to 14-year-olds. The programme should aim for over 90% uptake to maximise effectiveness and align with WHO's strategy. National HPV surveillance should be strengthened, and continued monitoring of the evolving evidence base is necessary. NIO published these recommendations last September, and the 1-dose programme is currently being implemented by the National Immunisation Office. Here are my references. I'd like to thank my co-authors and NIO for the opportunity to undertake this work, and the NIO for the opportunity to present here today. Thanks very much.
Thanks, Margaret. That was really, really helpful. I see there are a few questions in the chat, so what we'll try and do is we'll take those questions after the webinar. But Yvonne, are we okay to move on to you next, if that's okay?
Yep, thank you very much, Lucy. Thank you, Margaret. That was really, really helpful. So I hope everybody can see my slides and you can me as well. So today I just want to talk about sharing key messages. As always, I'm going to ask you to become a HPV vaccine champion. So I thought I would start today with a quote from the late Laura Brennan. Laura always said, get the facts, get the vaccine, protect our future, when she was speaking to parents and health and care professionals about the HPV vaccine. Today I want to share some of those facts with you and ask us ask you to join us as well in sharing those facts. As Lucy often mentions, health and care professionals are a trusted source of vaccine information in Ireland, and we all have a role to play in working towards eliminating cervical cancer. So let's start with some HPV virus facts. As Margaret mentioned, there are more than 100 types of HPV virus. So some of those HPV viruses can cause cervical cancer, some can cause genital warts as well. So the HPV virus can cause other cancers like vaginal cancer, vulval cancer, anal or rectal, and also penile cancers. And those cancers would be known, as high-risk HPV viruses that cause that. And then genital warts are caused by low-risk HPV viruses, so that's type 6 and 11, and these cannot cause cancer. So then if we want to take a look at the stats for Ireland, so it is estimated that each year in Ireland, HPV causes 406 cancers in both men and women. And over 6,500 women, unfortunately, will need hospital treatment for precancer of the cervix. 300 of those women will go on to develop cervical cancer, and unfortunately, 90 women will die from cervical cancer each year. So worldwide, if we look at the burden of HPV virus, so it actually causes 1 in 20 cancers worldwide. So what does that actually mean? So that means that it's estimated about 570,000 women and 60,000 men get an HPV related cancer each year. So the most important question we always have is there a way to prevent any of these cancers? So the screenshot here on the right is taken from one of our HPV videos, and the most important answer to that question is yes. The HPV vaccine protects against genital warts. It also protects against 9 out of 10 cervical cancers and also other cancers. So if we take a look, as has been mentioned a couple of times now since the programme was introduced in Ireland by the HSE in 2010, over 500 people have received the HPV vaccine, which is brilliant. And there's also, if you look worldwide, there's 100 million people who have had the vaccine as well. So when we talk about 100 million people, that's over 140 countries and territories who now give HPV as part of their national immunisation schedule. And in 50 of those countries, the programme is actually delivered to both boys and girls. So some of those countries are listed here. So they include the US, the UK, Australia, New Zealand and Norway as well. So a question we actually get asked quite often is the HPV vaccine safe? So what I want to reiterate is that all vaccines, not just HPV, every single vaccine is strictly monitored and reviewed regularly by international bodies. So the World Health Organization, the European Medicines Agency, and the Centre for Disease Control and Prevention in the USA. And obviously in Ireland, we also have the HPRA. And I just want to stress that all national and international bodies have continually reported that the HPV vaccine is safe. So because we get that question in quite a bit into our office, we've actually developed a section on our website, immunisation.ie, where we have over 100 papers and web links with information about vaccine safety and vaccine effectiveness from all over the world. And I would strongly encourage you to go and visit that website and have a look at that information. So the next question we often get asked is, what can people expect after getting the HPV vaccine? So for most people, they've no problems at all. For some people, they may have an area of soreness or swelling or redness in the arm where the injection was given, and this is quite common with all of the vaccines. And for some people, they may have a headache or feel sick in their tummy or run a slight temperature. But the most important thing about this is for the vast majority of people, that passes after a day or so. So we've heard quite a bit about the HPV vaccine. It's been used for over 16 years, and a really important question is, does the vaccine work? So on this slide here, you can see 2 studies. So a study published in November 2021 in England advised that the HPV immunisation programme has successfully almost eliminated cervical cancer in women born since the 1st of September 1995. And then in the other study published in October 2020 from Sweden, there's been reports of a big reduction in the risk of invasive cervical cancer in the population. So in the study, cervical cancer was diagnosed in 538 women who had not received the Gardasil vaccine, and in only 19 women had received the vaccine. So as always, as I mentioned at the very start, I am imploring you all to become vaccine champions. So I want to give you some tools to help you become those champions. So we have 2 HSE modules on HSE Land, which is our free e-learning platform for health and care professionals. And I would encourage you to complete those modules. So the first one here is the HPV vaccine, and that is actually split into 2 parts. So the first part covers the virus and the vaccine, and the second part is for people who are vaccinating. So it'll give you a little bit of extra information. The other programme I would recommend is our Talking About Immunisation programme. So it shares how you can effectively communicate with people who may be hesitant about vaccines. So it uses the technique of motivational interviewing, and it also contains lots of practical advice. So both of those programs are only about 30 minutes long, and they're really, really good programs. So another thing that you can do when people come to you and they ask you your advice about vaccines, which often happens, I would strongly recommend that you point them towards credible sources of information. So as I mentioned earlier, immunisation.ie has over 100 links about vaccine safety. But for members of the public, they can also visit hpv.ie, which is our website, which gives information about the HPV vaccine, the programme in Ireland, and why it's so important. Other sources that you could consider pointing people towards are the WHO or the CDC or the NHS websites. But I would recommend being careful doing that because programme delivery can differ depending on what country you're in, and that might cause a little bit of confusion. So next, I just want to share that our office have a presence on social media. So we have accounts on Twitter, Instagram, YouTube and LinkedIn. If you're looking for us on Twitter or Instagram, it's HSEIM, so HSEIMM. And if you're looking for us on LinkedIn or YouTube, you search for the National Immunisation Office. And as always, I always say, don't forget to hit subscribe or to follow so that you can see the latest posts from our office about HPV and all the other vaccinations that are provided in Ireland. So for each vaccination programme, you'll find videos, tweets, posts or reels that you can share on your own profile just to help spread accurate and up-to-date information, and also to point people that you're supporting back to a credible source as well. So the final recommendation I want to make is about misinformation. So in every part of our lives, there is a potential for misinformation. It's not just related to health. But what I'm going to ask is please don't decide that somebody else will report vaccine misinformation. All have a responsibility to report it, and the WHO have put together a webpage that will actually help us all to report misinformation on each of the different platforms. So if you search in Google, WHO report misinformation, a web page will pop up with links so that you can actually make those reports. So my final thought for today is an ask. Will you now join us in becoming a vaccine champion and protecting our future? Thank you very much.
That's great. Thank you very much, Yvonne. So that concludes the formal presentation part of the seminar.